Let me ask you something. How much time does your practice spend chasing down denied claims? How often do billing errors delay your payments? And how much revenue are you leaving on the table because claims sit untouched or get submitted incorrectly? If you're like most physicians, medical billing is one of the most frustrating parts of running a practice. You didn't go to medical school to become an expert in CPT codes, insurance denials, and claim resubmissions. But billing mistakes cost you real money, and time you should be spending with patients. That's where virtual medical billing comes in, and I want to explain exactly what we do and how it changes your practice's financial health. Here's the problem you're facing right now. Medical billing is complex. You've got thousands of procedure codes, constantly changing insurance requirements, prior authorization headaches, and claim denials that require follow-up. If your in-house staff is handling billing, they're juggling it alongside scheduling, patient calls, and front desk duties. The result? Claims get submitted late, coding errors slip through, denials pile up, and your cash flow suffers. Even if you have dedicated billing staff, you're paying $40,000 to $50,000 per year in salary, plus benefits, payroll taxes, and overhead. And when that person takes vacation or calls in sick, your billing stops completely. Now let me explain what virtual medical billing actually does for you. We take over your entire billing process from end to end. After each patient visit, our certified medical coders review the documentation, assign the correct CPT and ICD-10 codes, and submit clean claims to insurance companies electronically. We're not guessing at codes, we're trained professionals who stay current with coding updates and payer-specific requirements. But we don't stop at submission. This is where most practices lose money. We track every single claim. If a claim gets denied, we immediately investigate why, correct the issue, and resubmit it. We follow up persistently with insurance companies until payment is received. We handle patient billing statements, payment plans, and collections professionally. And we provide you with detailed reporting so you always know your practice's financial position. Let's talk about what this means in real numbers. Practices handling billing in-house average claim denial rates of 10 to 15%. That means 1 out of every 10 claims you submit gets rejected and requires rework. With virtual medical billing, denial rates typically drop to 5% or less because we're submitting clean claims from the start. Payment speed improves dramatically. Instead of waiting 45 to 60 days for reimbursement, practices using professional billing services see payments in 25 to 35 days on average. That's money in your account weeks earlier. And here's the cost difference. An in-house billing specialist costs $55,000 to $65,000 annually when you factor in salary, benefits, and overhead. Virtual medical billing typically runs 4 to 8% of collections. For a practice collecting $1 million annually, that's $40,000 to $80,000. Often less than one full-time employee, and you're getting an entire team of billing specialists, not just one person who might quit or retire. Now, I know what you're thinking. Is this secure? What about HIPAA compliance? Virtual billing companies operate under strict HIPAA regulations. We sign business associate agreements, use encrypted systems for all data transmission, and work in secure environments with audit trails tracking every action. Your patient data is protected the same way it would be if you were handling billing internally. Actually, often better because we have dedicated IT security infrastructure. How does it work day to day? It's simpler than you think. After each patient encounter, your EHR system sends documentation to our billing team electronically. We review it, code it, and submit claims, usually within 24 to 48 hours. You don't change your workflow. Your front desk still collects copays. Your staff still enters charges. We just take over everything that happens after that: the coding, submission, follow-up, denial management, and payment posting. You get a dedicated billing team and account manager. You have access to real-time reporting dashboards showing exactly where every claim stands. You can see your account's receivable aging, denial reasons, collection rates, and revenue trends. Complete transparency. Let me give you a real example. A family practice with 3 physicians was struggling with billing. They had one in-house biller who was overwhelmed, claims were aging past 90 days, and their denial rate was 14%. They switched to virtual medical billing. Within 90 days, their denial rate dropped to 4%. Their average collection time decreased from 52 days to 31 days, and they recovered $47,000 in previously denied claims that had been sitting untouched. Their monthly collections increased by 18% with the same patient volume, just by getting paid properly for the work they were already doing. Here's what it comes down to. Every denied claim is money you earned but didn't collect. Every delayed payment hurts your cash flow. Every billing error is time your staff spends fixing problems instead of serving patients. Virtual medical billing eliminates these problems professionally and cost-effectively. You focus on medicine. We focus on getting you paid accurately and quickly. You stop worrying about coding updates, payer policy changes, and denied claims. You start seeing faster payments, fewer errors, and predictable revenue. If your practice is dealing with billing backlogs, high denial rates, slow collections, or you're just tired of the billing headache, virtual medical billing isn't just an alternative. It's a better system that protects your revenue and frees your team to do what they do best. The question isn't whether you can afford to outsource your billing. The question is whether you can afford not to. Virtual medical billing.